your knee was starting to come in a little bit like this, which we call knee valgus. So essentially that means just like something's happening where your knee's coming in towards you, which is not really what we want when you're doing your rehab. There's a lot of structures and muscles in the body that kind of help keep that from happening and preventing it. So if it's weak or if it's injured, it could cause you to come in like that. One of the best muscles that we work with is the gluteus medius muscle, and that muscle actually helps you keep your knee straight. So if that's weak, it actually can make your knee come in a little bit, which is what I'm suspecting based on what you were doing. So I'm going to teach you an exercise that will help you strengthen your gluteus medius. Okay? So I'm going to show you first, and then I'm going to have you do it, and we'll go from there. So the first thing you're going to do is you're going to put this band over your knees, just above them. You won't want them on them. And then you're going to go on your side like this. Make sure your heels are kind of aligned with your pelvis. And you're going to kind of just lay like this. And one of the key things what we're working on today is technique. So don't worry too much about the actual strengthening part. We just want to make sure that you're doing this correctly so that when you do it in the future, you know how to do it. So the most important thing with this exercise is keeping your heels together. So you're going to do some motion like this. We want to make sure these heels kind of glue together while you're doing it so they don't move up. You also want to make sure that your hips are aligned in the front. You don't want them tilting forward, or you don't want them tilting backwards, because that won't be efficient when you're working the muscle. So what I'm going to have you do, and we're going to do this for 3 sets of 8 reps. I'm just going to have you do one for now just to see how you can do it and see if your technique's good. We're going to go up for 2 seconds, and I want you to come back down for 4 seconds. So like a tempo of 2 seconds, 1, 2, and down, 1, 2, 3, 4. And just make sure that that hip's staying up and those ankles are staying together. So it's just 1, 2, 1, 2, 3, 4. Okay, you want to try it out?
Yep.
All right. So I'll give you this. So make sure to keep those heels together and keep that pelvis up. And we'll do it for up for 2 and down for 4. And I'm just going to have you do it 8 times.
Okay.
1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. And yeah, keep doing it. We'll do 2 more. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. Okay. I think you did a great job keeping your heels together is what I asked. And you also did a great job with your tempo. You kept it 2 seconds up and 4 seconds down, which is what we want. The only thing is I saw your hips kind of come down a little bit more like this. So what I'm going to do is just have you lean against me. So I'm going to act kind of like a barrier so you know to keep your hips up. Okay? So we'll do it 4 more times and just work on this. So go ahead. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 2 more. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. That was a lot better. So next time we can try to do that again, and then I can go in the back of you, but I'm not going to have myself against you. We're going to try to do that again. But that was the clamshells, and we're going to do that for 3 by 8. Okay, so what I'm going to show you first is an exercise that we categorize as open kinetic chain. So what that means is you're doing an exercise, but your feet aren't on the ground. So this would be a closed kinetic chain is when your feet are up, but your feet right now are open because they're not sitting on the ground. So it's really important that when we do these exercises, especially for your injury, to not go too far with your leg because we can cause something called anterior shearing. With that, essentially, your ACL works really hard to prevent your knee from coming in and your bone coming up like this. And because it's so still like healing, it might cause that to happen. So we don't want to go too far up where you're going to hurt yourself. So we're going to do this in kind of a range that's safe for your knee. So I'm going to show you the exercise first, and then I'll have you do it, and we'll do it for 3 by 8 because we're trying to strengthen your quads. So what you're going to do is you're going to just dangle over the table like this. And this is 90 degrees. I want you to go to about 45, so half of that, just right here. I want you to go up 1, 2, and then go down for 4 seconds. 1, 2, 3, 4. And again, this is about technique. I don't want you to really focus on trying to work on the strengthening right now because this is the first time you're doing it. So we really just want to make sure you're doing it efficiently. At the same time, I do want you to kind of focus on trying to contract your quad at the same time too, so this exercise does work. So while you're doing it, you start here and just kind of push your knee into the table almost and come up. 1, 2, 1, 2, 3, 4. I'm going to put my hand right here so you know where not to go, so we prevent that, that shearing from happening so your knee doesn't get worse than it is. Okay? All right. So I'm going to put my hand right here. I want you to go up for 2 seconds and come back down for 4. And we'll do that 8 times and see how you're doing. Okay. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. We'll do 3 more. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. Good. Okay, so you did a good job with your tempo. The only thing I would say is when you're going up, you can go a little bit faster. You don't have to go as slow. And just make sure you're reaching to my hand because we don't want you to go too, not too long where it's not going to do anything. But you're doing a good job keeping mindful of not going too far up. Okay. So we'll try that again 5 more times and see how it goes. And remember, just keep contracting your quad, kind of push your leg down so you feel it contracting like in here. Okay. Go ahead. 1, 2, 1, 2, 3, 4. 1, 2. 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. We'll do one more. 1, 2, 1, 2, 3, 4. That looked a lot better. You did a great job with keeping that tempo again, and I can also see you contracting, so that was really good. So we'll keep doing that and seeing how that goes for you. But just remember, it's really important to not go past that 45 degrees for the time being so we don't injure it anymore. So another exercise I'm going to teach you for your knee is something called the closed kinetic chain terminal knee extension, which is a long word, so we just call it a TKE. One of the benefits for this is it's one of those exercises where it doesn't go in a range that's going to hurt you, like the OKC was. So when we're on the ground with the closed kinetic chain, we want to keep it 0 degrees to 30 degrees. So 0 would be kind of straight, and then 30 is just a little bit. So this exercise is a good exercise for your quads to strengthen coming back from an ACL injury. So I'm going to show you it, and then we're going to go ahead and do it. So like I said, one of the main goals for this is trying to contract that quad. So we're not necessarily looking for strength right now, but more technique, so I want you to work on that. So I have this band tied, and you're just going to put your knee right into it. So you want to get something sturdy that's going to hold the band in place. And naturally you're going to want to bend, which is what the exercise is. But we're going to start out straight. Again, with technique is really important for this. So you want to make sure that your shoulders are up, back's up, and then chin's kind of tucked a little bit. And what you're going to do is while you're in this position, you're going to bend your knee to about 30 degrees, which looks like this roughly. We don't want to go further than that because we don't want you to get hurt. And you're going to do that in a count of 4. So you're going to go 1, 2, 3, 4. And then you're going to come back and extend your knee again. And while you're doing that, I really want you to focus on digging your heel into the ground. So when you're pushing back, pretend that you're just kind of stomping your foot into the ground and just pulling it back with your knee, using your quads. So I want you to contract at the same time as well. So focus on keeping and driving that heel down into the ground, and then just 1, 2. Almost pretend that you're trying to pull the band back with the back of your knee. So while you're doing this, you might feel a slight stretch, which is normal, and we're looking for that. That means that you're doing it well. So again, just 1, 2, 3, 4. Dig that heel into the ground, and 1, 2. You're gonna do that 3 by 8, and then I'm gonna check it for you and just see if we need to fix anything. So again, just focus on staying straight, and then the 1, 2, 3, 4, and then 1, 2. And on that 1, 2, just remember to keep contracting that quad and dig that heel down into the ground. 2, 3, 4, 1, 2. 1, 2, 3, 4, 1, 2. 1, 2, 3, 4, 1, 2. We'll do it 4 more times. 1, 2, 3, 4, 1, 2. 1, 2, 3, 4, 1, 2. 1, 2, 3, 4, 1, 2. 1, 2, 3, 4, 1, 2. That looks good. Something I forgot to mention that was on my part, but when you are going down like this, I want you to focus on keeping your hips up too. So don't try to tilt down and then forward, just try to keep it straight. Okay. Which you did a good job of. I was just wanted to make sure that was being brought upon. But let's do 4 more, and then 1, 2, 3, 4, 1, 2, 1, 2, 3, 4, 1, 2, 4. We'll do 1 more. 4, 1, 2. Okay, good. You had really good technique. The tempo was perfect. I don't think you went too fast or too slow with it, and you did a good job keeping your hips aligned. So again, that's one of those exercises that will really help with your ACL rehab and contracting that quad, getting that strength back so that you can kind of have that stabilizing muscle for your knee. Okay, so because you're having patellofemoral pain, which is just like in your kneecap area, one of the most common ways that can cause that pain is a subluxation or a dislocation. So subluxation is kind of dislocated, but not all the way, and then dislocated is all the way out of its socket. So what I'm going to do is perform that patella apprehensive test, and we're going to test the integrity of your kneecap just to see what's going on, see if there's any pain with that. So what I'm going to have you do is just sit up and then lie your legs on the table. Perfect. Down? Yeah, just put it down. And it's just this one, right? Okay. So because this is the injured one, I'm going to start with the uninjured just so you can see what it feels like. So what I'm essentially going to do is bring your kneecap and just push it to the outside side of your leg. Okay? So that's what it is. So now I'm going to do it on this side. And just let me know if you have any pain. Okay. And that feels okay? Mm-hmm. Okay. So with this test, the patella apprehensive test, if they have pain as you push the patella laterally, there would be a positive sign. So the next special test I'm going to test for is for the gluteus medius, because with patellofemoral pain, if there's any valgus forces on the knee, it could cause that pain. And one of the most common muscles that can cause the painness is the gluteus medius. So we're testing for a weak gluteus medius muscle with this, and this is the Donatelli test. So I have my patient on her side like this. What I'm going to do is I'm just going to bring your leg up like this. This is the uninjured side first. What I'm going to do is bring your leg up like this, and I just want you to completely relax. What I'm going to do is just bring your leg out like this a little bit, and I'm not going to tell you, but at one point I'm going to drop your leg a little bit, and then just try to keep your weight up as much as you can. So I'm not going to tell you. I'm going to do this twice on this side and then twice on your other side, on your injured side. Okay?
Yeah, all sides. And
good. Okay, I'm just going to do it one more time, but I'm not going to tell you when I do it. Good. Okay. So we're gonna flip on our other side and onto your injured side. So you can just come on this side.
Oh, yes.
We're gonna do the same exact thing. So just make sure your legs are nice and straight, up like that, and the same exact thing. So I'm just gonna bring your leg up. I'm not gonna tell you when I'm gonna do it, but I'm gonna drop your leg a little bit. Okay, so you can relax. Good. So a little bit of extension like that, and just let me know if you have any pain for some reason. Okay. Good. I'm gonna do it one more time, and I'm just not gonna tell you. Good. Okay. So if this test was positive, the patient would not be able to keep their leg up. It would just go all the way down because of the weakness in the gluteus medius. And for this particular situation, my patient was able to keep her leg up, which means that there was no weakness in the gluteus medius. And another reason why you might be having patella pain is because of your iliotibial band. So there's this long band that starts in your hip and goes all the way down to kind of the front of your knee. That is kind of like a bunch of fibers that work together. And if that is tight, it could cause kind of your knee to move a little bit, which can be painful and cause that pain. So I'm just going to show you a special test to just see if your IT band is tight right now. And if it is, we can figure out and see if that's what's causing your pain. Okay. So what I'm going to have you do is you're going to lie on your side, facing away from me. So you're back to me. Good, and then we're just going to keep straight. Perfect. I'll hold you. So what I'm going to do is, so this is your uninjured side. I'm going to bring your leg up and out a little bit, and all I'm going to do is just kind of slowly take this leg off the table. And we're just going to see if your leg stays up or if it goes down. And if it goes down, that means it's negative. And if your leg kind of stays up in the air a little bit more, that might just suspect that you have a tight IT band. Okay. So we're going to do it on the uninjured side first, and then I'm going to come over on this side and we'll do the injured. Okay. So you can relax for me. So all I'm going to do is just bring your leg up like this. We'll bring it a little like this. And then I'm just going to slowly bring it down. Good. All right. Now we're just going to do the other side. So if you just flip on that side, I'm just going to do your other side. There shouldn't be any pain with this, but if there happens to be pain, just let me know, and we'll try to figure out what's going on. But again, there shouldn't be any pain. So same thing, I just want you to lie on your side. If you can squish just a tad bit, I'll hold you, don't worry. So same thing, just give me your limb, just completely relax. We'll bring it up again, out, and then we'll just see if there's tightness. Okay. Good. So there's no tightness, which is good. So if you did have a positive test, like I said, I'm bringing your leg out kind of like this. If this didn't come or get out of that positioning, if it stayed in this kind of up positioning, that would mean it's a positive test. So you might have a tight IT band, which could be causing the pain in your patella. So I'm going to teach you a balance exercise now. So what we're going to do is, because of your injury, you had the ankle sprain, it's really important to get your balance back. So that's one of the most important rehab goals that we have, is balance. If you don't have balance, your center of gravity is kind of off, so you don't have anything kind of keeping you up. If you're walking, running, going up the stairs, if that's off, then you might have difficulty in your everyday life. So we want to kind of get that back for you and see what's going on. We have something called the kinetic chain, and it starts from your hips, it goes down your leg, and then eventually ends to your ankle. If anything in that kinetic chain is unstable, it might kind of decrease your balance and your ability to do everyday activities. So what I'm going to do is show you a balance exercise. This would be a semi-dynamic balance exercise, which means we have you, your actual body stable, but we put you on an unstable surface. So this is an air exercise. It's kind of squishy. And what I'm going to do is I'm going to have you stand on this. And I'm going to have you go with one leg on your injured leg. You're going to hold like this for 15 seconds. And then I'll see what you can do from there, if we have to adjust and make any changes. Okay? So on your injured leg, just go ahead and stand on it. And we're gonna do this for 15 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. So that was a little difficult, right?
Mm-hmm.
Okay, so because that was difficult, I don't want you to keep doing that because it could injure you further, or just make it harder. You're gonna get frustrated, and it's just not gonna be a good exercise to get you back to where you need to be. So instead of having you on one foot like this, I'm gonna have you 2 feet planted. And with this, I'm gonna have you close your eyes. It might seem silly, but just closing your eyes can kind of throw your balance off a lot. So because you weren't able to do the single, we're gonna do double with eyes closed. Same thing for 15 seconds. And we're just gonna hold like this. And we're gonna do it 3 by 15. I'm just gonna have you do one for now.
Okay.
Just to see if you can do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. That was a lot better. You did a good job. Obviously with your eyes closed, it's a little more difficult with your eyes open, but I thought you did a really good job keeping your balance and trying to kind of be aware of your situation, which is really important with balance. You want to make sure that you know what your perception is and what you're doing. And then in the long run, that'll help you a lot when you're getting back to play. You'll have your balance and you'll be able to hold yourself up, which is really important. Which you were able to do with the double leg. The single leg was kind of difficult, so we had to regress, which is okay. If you happen to do good with your single leg, I would have you close your eyes and we would do the 3 by 15 seconds again. Okay, so because you're coming back from your ankle sprain, it's really important to do some strengthening exercises. So today I'm going to show you one of the strengthening exercises for your ankle that you can do. This is full weight bear, which means that you're putting all your weight on it instead of having like partial or non-weight bear at all. So this exercise is really important because with strength comes stability, and if your ankle's not stable, it's weak, the muscles in your lower ankle and leg are weak, it might impair your walking in your everyday life and everything you do, not just walking, so it could be difficult to kind of have to go through that. So I'm going to teach you a strength exercise. I'm going to show you it first, and then I'm going to have you do it. And then if there's any critiques, if I want to give you anything else, if I think you're doing well or something to work on, I'll let you know after.
Okay.
So we're going to do this 3 by 8 because we're going to try to strengthen your ankle muscles. So this is heel raises. So I'm going to have you start with the wall at first because it can be a little difficult. What I want you to do is you're going to come up on your heels, off your heels, sorry. 1, 2. And then on your injured leg, I want you to weight bear on it. So you're only going to have your injured leg being up. And you're going to come down for 4 seconds. 1, 2, 3, 4. You're going to put your foot again, go up for 2 seconds. 1, 2. Lift off. And then 1, 2, 3, 4. I'll have you do that for 1 set right now, and I'm going to have you do it 8 times. And then we'll go from there.
Okay.
So go ahead and go on the wall. Go up for 2. Good. 3, 4. 1, 2. 1, 2, 3, 4. 1, 2. 1, 2, 3, 4. 1, 2. 1, 2, 3, 4. 1, 2. 1, 2, 3, 4. We'll do 3 more. 1, 2. 1, 2, 3, 4. 1, 2. 1, 2, 3, 4. One more. 1, 2. 1, 2, 3, 4. Okay, you did a great job with your tempo. You did a great job putting all your weight on this leg, which I really wanted you to emphasize. Again, this is a strengthening exercise, so being able to do that is really good. What I would recommend though, the next time you do it, is when you go up, I want you to just bring your leg up a little bit higher.
Okay.
So it just doesn't seem to be like this. And if you are having difficulties with that, you can let me know if it's too much to just go on 1, because we can go to 2. But let's try to do like 4 more. And I just want you to emphasize going 1, 2, Lift up a little bit higher, and 1, 2, 3, 4. Okay. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. One more. 1, 2, 1, 2, 3, 4. Okay, good job. You did a better job with that. Again, you kept your tempo really well, and you did a good job with stabilizing yourself on your one leg.